Welcome to Community Health Matters. I'm your host, Amy Marsalis. On today's show, we'll learn about psoriasis, TriStar Centennial's new pediatric hematology oncology unit, and virtual care. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. Hi everyone, most likely you've heard of psoriasis, but you may not realize how chronic this condition can be, how it can occur on almost any part of the body, and it can be associated with several other very serious illnesses. Here to talk more about it and educate us a lot more about psoriasis is Dr. Keith Lovin with Rivergate Dermatology and Skincare Center. So good to have you here with us today.
Oh, it's very good to be here, Amy.
You know, this is an autoimmune disease. I know that, but tell us, what are some of the triggers? What causes this autoimmune response in some people?
Yeah, and Amy, we really don't know. We know that genetics and your immune system play a major role in psoriasis, and then beyond that you have triggers that get everything going, but we're not sure why that occurs. We do know that a lot of the the patients that have this are just sailing along in life and really have nothing that they can really tell that's out of the ordinary, but it will just flare up for them.
Mm-hmm. Is there a certain age of onset when you tend to see psoriasis more?
Yeah, yes, there is, and it's a bimodal curve. I mean,
What does that mean?
you have an increased number of patients in their early teens and mid-teens and early 20s that will get it. Then it kind of levels off a little bit, and then in the 50s and 60s you'll get another surge and people will be diagnosed with psoriasis. We think that the earlier ones are more of the genetic, the later ones may have more of an environmental factor, but it's a combination of both of those.
Are a lot of the cases, the majority, associated with things like heart disease, diabetes, and I read even depression?
Yes, you have a lot of comorbidities that are associated, and we think that the common denominator is the inflammation, because psoriasis is an inflammatory disorder, and these others are, and you have diabetes and high blood pressure, increased cholesterol, triglycerides, heart attacks, strokes, all are increased in patients with psoriasis, and so it's so important for them to go and get a good physical and keep an eye on their health, because they are at increased risk of these things.
What are the symptoms? I think of like a lot of uncomfortable itching and scaly kind of skin.
Yes, and they do, and some people have the itching and others will not, but it can, if you have them like on your palms and soles, they can fissure and they can crack and form a lot of pain. Some people do get a lot of the itching when it comes up on the body. In certain areas of the skin, it can macerate or turn really moist, like under your arms and in the groin, and can cause a lot of problems like that. You also have nail disorders that can occur because of the psoriasis. Also, you can have tendon problems and pain and joint pain because you have psoriatic arthritis that is also associated with psoriasis.
Do you tend to have it more on your hands and arms? You don't get it on your face typically, do you?
Not typically.
Not typically.
The most common type, is the plaque psoriasis, and that is mostly on your scalp, on your elbows, knees, and on your lower back. But it can occur anywhere.
Okay. How do you diagnose this? How is it diagnosed?
Yeah. It is a clinical diagnosis. There's no special blood test to be able to tell whether it's psoriasis or not. So you come into your dermatologist or healthcare provider, and they will examine you and see whether you have, the typical psoriasis. Family history can be important. With the family history, if you have somebody comes in with psoriasis, usually about a third of them will have a family history of that. And if you have one parent that has psoriasis, the child has about 10% chance of having the psoriasis, and if you have both parents that have psoriasis, they have about a 50% chance of having offspring with psoriasis. So there's a definite genetic tendency.
Okay, so there is that genetic predisposition, it sounds like.
Yeah.
But as far as it being passed from one person to the next, Is it contagious?
It is not contagious.
It is not?
Absolutely
Okay.
not.
Okay.
And so that's something that everybody needs to realize, because, you know, when patients go up and they're people with psoriasis and they go into the store, you know, people kind of flinch back a little bit
Sure.
and say, you know, what's going on and what do they have, and which is a terrible thing, and that's why it's nice we have so many new treatments. But you know, the people with psoriasis, you know, have had a really hard time, and it's been really nice that we're having new things that are coming on with that. And you know, we know that about 10% of the population has the genes that are passed on, one or more genes that predisposes you to psoriasis, but only 2 to 3% actually get the psoriasis. So, you know, there are other factors other than plain genetics that causes psoriasis to manifest itself.
Is there a way to prevent it if you know it's in your family? Anything, I mean, do you stay out of the sun? I mean, I know it's not good to be in the sun anyway, but are there certain things you can do to hold it at bay? Or?
Actually, this is one of these conditions where we actually tell patients it's
Get
okay
in
to
the
get in the
sun.
sun, yeah, because
Okay.
sunlight actually helps. Of course, you have to, you know, be careful not overdo it, but there's really nothing to prevent it. You know, it's one of those things that if it's going to happen, it's more bad luck in life. But once you have it, then there are things that you can do to try to help, you know, keep it from flaring up so much. You know, eating right, staying healthy. You know, don't do anything excess like the drinking or smoking and that, and you know, just stay, you know, just a healthy body, because it's like any systemic disorder, and it is a systemic disorder. It's not just on your skin. Your overall health will influence how bad it is.
What are some of the treatments? Because we talked before about the light box treatment.
Yes.
So you said now there are more oral medications, or is it more topical or oral meds?
Yeah. You know, I've been in practice over 30 years now. And when I started, there were the topicals and you know, the creams, the steroid creams. We did the phototherapy was a big part of that.
I remember that.
And then I've been fortunate enough to be involved in a lot of clinical research with a lot of these new products that have come out, and they have just revolutionized things. The biologics are the ones that are really the drugs that are you're seeing on TV.
Is that the Humira?
Humira, Umbrel, Raptiva, Stelara, you know, Tremfya, Cosintex salts. A lot of these, and you know, we're no longer, you know, back in the day, you know when I was first started, we had drugs that if we could get somebody 50% better, we thought we were really accomplishing something. And then when the studies first came out, if we got 3/4 improvement, now people are talking about, you know, 95 to 100% clearing, and it is just fantastic.
Wonderful.
I mean, and it's something that, you know, it's fun to treat. And we always enjoyed it and got people better, but it really is fun to treat now.
So good news on that front, on psoriasis.
Yes,
Thank you
yes.
so much for coming in and talking to us.
Well, you are
Appreciate
so welcome.
it.
Thank
All right,
you.
good to see you again.
Yeah.
And we'll be back with a whole lot more right after this. Some of you may not realize that there is a fairly new unit at TriStar that is specifically designed for young patients with cancer, a pediatric hematology and oncology floor that is new in our area. And Dr. Haidar Frangul and Dr. Jennifer Dahm are two of the kind of miracle workers there, I would say, with very special patients. And we're so glad that you came in today to talk to us about.
Thank you for having us.
Let's talk about this new unit and the kind of treatments you offer, Dr. Frangul, if we could start with you.
Yeah, so it's really interesting. First of all, we like to thank the support we have received from Children's Hospital and TriStar Children's Hospital for building this new unit for our patients. This unit has 11 beds. The patients in it can receive state-of-the-art pediatric oncology therapy and stem cell transplants. The whole unit is HEPA filtered, so the air is safe for these children to breathe, and they are able to get out of the room and play. So with the patients there are safe from any infections because they are immunocompromised patients. But it's a brand new unit that has all the amenities that will make the stay for these children and their families very pleasant during that time of therapy that they'll be here.
Almost a home-like atmosphere with a play area for these children.
Correct. It's really amazing because some of these patients are coming from out of town and they have to spend 30 or 40 days in the hospital, so this is second home for them.
What type of treatments do you offer there?
Well, we offer the variety of treatment for pediatric cancers and blood diseases, as well as bone marrow and stem cell transplantation for patients that need a transplant.
So if they're there for the bone marrow transplant, then they may be there for quite a chunk of time.
30 to 40 days sometimes, yes.
Because they're immunosuppressed.
Correct.
And okay.
Correct.
All right. How are a lot of these cancers usually identified and diagnosed? Because I was reading in a little bit of the material, Dr. Dahm, that oftentimes the parents, of course, don't realize that how serious the symptoms may be. They may appear to be other things, more common illnesses. Can you elaborate?
Sure. You're absolutely correct. A lot of times it's very difficult to tell what is serious and what's not quite as serious. The most common types of tumors that we generally see in pediatric oncology are leukemias and brain tumors. Those are the most common types. And so patients that have leukemia that are presenting with symptoms, they might have symptoms related to their blood counts. So for example, they might have anemia that might be quite profound, which may give them headaches, fatigue, not as energetic to do daily activities. They may have easy bruising or even some bleeding, like a nosebleed, for example, because of low platelet counts. Or they might just have persistent fevers because of their disease, a fever that keeps going on and on and on, and nobody's really found a particular source of infection, potentially. Also, definitely, if people have a brain tumor, they could have vomiting that's unexplained, they could have headaches, they could certainly have pain in any location too, depending upon where the tumor is. And in particular, the leukemia patients do often present with inability to walk, because young children can complain about bone pain and not want to bear weight with walking.
Okay. Are there certain signs or symptoms? So actually, you've gone through some of those things, though, that parents might be able to identify, or certainly their pediatricians, if they took them to their pediatricians.
Well, I always say I think pediatricians have very challenging jobs. Anybody in primary care does, because a headache doesn't necessarily always mean that a patient has something as serious as a brain tumor. So I think wise advice is definitely, if you are concerned about a symptom that your child or a family member might have, definitely it would be worthwhile to talk to your primary care provider or pediatrician and go through the history and the symptoms together, and then together as a team help determine what kind of workup needs to be done.
Can you tell us about the research that you're doing at the unit, in addition to offering treatments? So it's a research center as well.
Sure. So we are part of the Sarah Cannon Research Institute, and we offer clinical trials for patients with various types of cancers. Our group is part of a national group called the Children Oncology Group. We have more than 30 or 40 clinical trials that we offer for any variety of tumors or cancers that patients can present with. In addition, we have multiple supportive care as well as stem cell transplant trials that the patients are eligible for. So they truly, if they come, they are potentially can receive the state-of-the-art therapy, including experimental therapy for those cancers.
Aren't we fortunate to live in the area that we do and to be able to offer this to these sick kids? What are the survival rates? It sounds like from what we were talking about earlier that it's pretty encouraging that a lot of these children do very, very well. But the sooner they get there, the better, right? The sooner you can see them.
Well, I was just going to say, I think it obviously varies quite a bit depending, number one, on what your diagnosis is, of course, and then how extensive the disease is at the time that it's diagnosed. So generally it is better to find it earlier rather than later, particularly for diseases that metastasize and go to different locations in the body. So the earlier the better. That being said, though, we've made significant advancements in just the field of pediatric oncology, and so most of the time we have patients that have very, very good outcomes, and that's part of what's so inspiring for us to work with these patients and families, because they do well, and we hope to follow them for years and decades to come.
That's what I always think, what a tough job you have working with these sick kids, but you said no, it's very, very inspirational to work with these children.
Absolutely.
And they're so brave.
They are very brave. They're very brave. And you know, they are so, I mean, this happens to them of no fault to themselves, correct? So, and they are amazing. They are fighters.
They sure are. All right, and I know there's more information we've had on the screen, the TriStar Medline and accco.org for more information. Thank you both for taking the time.
Thank you for
Thank you for
us.
having us.
Thank you for all you do.
Oh, thank you.
Thank you.
All right, and we'll be right back after this. There's on demand for so many things in our world, so why not for medical care and for things that are your non-emergency conditions? And that's what my next guest is here to talk to us about. So good to see you, Dr. Fahad Tahir with St. Thomas Medical Partners. Nice to see you today.
Nice to see you too. Thank you for having me.
Sure. I know this sort of came about. You talked about your wife being sick at an airport, and you kind of stumbled on to this kind of service, and we know it's grown in its application as technology has gotten better as well. Tell us about how you're using it at St. Thomas.
Exactly, that's exactly right. My wife was we were in an airport on a Friday night. My wife wanted to get access to immediate care, and it was a Friday night. She didn't want to keep, feeling sick all weekend. And so we immediately said, what are our options? What's immediately available to us? And we saw this technology that was available in another city, and we thought, why can't it be here in Nashville? And so as part of our mission at St. Thomas to enhance access to health and well-being, want to make it convenient for patients in our growing community, we thought, we know we've added all these locations across Middle Tennessee at St. Thomas, but why not go this extra step of creating this added access, this added convenience of having virtual care available, a great clinician, a physician or advanced practitioner available right on your phone or on your mobile device, so you can see a clinician just like you can access all other parts of your life through technology. And the technology's improved incredibly, just like our phones have improved over the last 10 years.
With the cameras, as you said, with better cameras that can see so much and very clear images. So what kind of ailments are best suited for virtual care?
Sure. Well, anything that would be it allergies, sinus, ear aches, things that you would go to a walk-in clinic for or an urgent care for, no broken bones, no chest pain, but really the things that you'd want to go in for when you're really just not feeling well and you need a caregiver to help you feel better.
I see, like even rashes, dermatitis, upper respiratory, even a urinary tract infection?
Sure, yeah. I think what we do is create clinical protocols with the help of our physicians who see our patients in the exam rooms of our practices to ensure that we have great guidelines that can be followed in a virtual environment.
Okay. How is it going so far? Are you getting a lot of use or a lot of people participating in this?
You know, we interviewed thousands of patients and what would create the kind of access and convenience that feels right. And patients ask for two things. Don't make me fight traffic to drive all the way into town for a simple doctor's visit and then wait in the waiting room. And so we said, let's bring our clinic locations, our care centers into the community, and then let's go this extra step and offer virtual care. So wonderful physicians, advanced practitioners licensed here in Tennessee can provide care for all of these simple ailments to avoid having to fight traffic and go into a care location.
Is virtual care, is this a safe alternative for patients out there to, being in front of someone, in person, one-on-one in a medical setting? It is safe?
Absolutely. We've created clinical guidelines created by board-certified physicians, and now this is being practiced in all 50 states across the country. We're glad at St. Thomas to be the first in the state of Tennessee to bring this service to the community.
You are the first.
We are, and we're excited about that. But we've seen this across the country, and the federal government's looking at how do we enhance our federal healthcare policies to use virtual care to enhance access, because there's a lot of communities, as we know, particularly the rural communities, where there's very limited access to physicians and caregivers. So we constantly ask ourselves, if we really take responsibility to manage the total health and well-being of the families in Middle Tennessee, how do we do that? And sometimes it's by adding care centers and locations closer to people's homes, but in other cases, virtual care can really enhance that access for folks.
I'm sure there's a bit of a learning curve, especially maybe with some of the older population that's not as familiar maybe with a smartphone or iPad or whatever their device is. Are you teaching them how to use that to set things up so that you can get a really clear image of what you maybe need to see? How to communicate back and forth?
We give patients the option. Sometimes a phone conversation is adequate depending on what the visit's need is, and in other cases a face-to-face visit is more critical. But I got to tell you, those smartphones, everyone's got them these days.
It's true.
And so it's incredible how comfortable all ages are, with this kind of smart technology. And because we use it in other aspects of our life, healthcare is actually not the first time that our grandparents and parents are starting to use it.
That's true, that's true. In what instances would the virtual visits not be appropriate?
You know, that's a great question. We are really thoughtful about making sure patients are in the right care setting for their needs. So if you have chest pain, we've got to take you to an emergency room. If you have a broken bone, or if you're bleeding, those situations aren't best addressed in virtual care. That's best addressed in an in-person setting, maybe an urgent care setting. So we're really sensitive to making sure patients get to the right destination for their care. So if a patient reaches out for virtual care and they're better served somewhere else, we won't charge them. We'll go ahead and take the patient directly to the appropriate care setting and direct them appropriately.
I saw on our list, I don't know if they could pop that up on the screen again, where it listed different things that would not be appropriate for a virtual visit. There it is again. It said even like dizziness, loss of consciousness, and suicidal thoughts. So any kind of emergency mental health crisis would certainly not be best served by the virtual care. Okay, so what is the cost associated with this? Does it vary from virtual visit to virtual visit?
No, we keep it very simple. We asked our patients, how do we make this simple, convenient, easy to access for you? And what patients said is, we don't want a complicated menu. Just tell us what it costs. And it costs $49.
$49, okay.
Exactly. So the idea was, how do we make it cost effective and accessible for all populations to afford, and cheaper than an emergency room copay on average, which is more than $49.
Absolutely. So to get more information about this for people who are watching and want to do this.
Yes, stthomasdoctors.com, easy to access. You can see a menu of locations close to people's homes, as well as directly get medical care right there on the web by see a clinician right now.
Okay, and finally, the most common thing you're diagnosing is, can you say, is it?
Allergies are very common, and sinus.
Okay, well that makes sense. And living in Middle Tennessee,
exactly,
you're bound to be affected by one of those.
And you can guess this time of year, it's very busy.
Absolutely. All right, Dr. Tahir, thank you very much.
Thank you very much.
Okay, take care. Thank you for watching Community Health Matters. Learn more ways to improve your health on our recently redesigned website, mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.